Hi, and welcome to Aging with Amy, where we help families to thrive, not just survive, the aging journey. Hi, everybody. Welcome back to Aging with Amy. This is the show where we help families to navigate the journey of aging with confidence and compassion. I'm your host, Nurse Amy, and today we're diving into a topic that has a profound impact on how we age, and that is hearing health. I'm really thrilled today to be joined by two incredible audiologists, Drs. Susan Timna and Cori Palmer from Expert Hearing, which is right here in Savannah. These two women are not only experts in their field, but they're also really passionate about helping people to reconnect with the world around them through better hearing. So whether you're caring for an aging parent, or even if you notice changes in your own hearing, or if you just want to learn about how hearing loss can affect our brains and our safety, our relationships, then this conversation is for you. So let's go ahead and start diving in. Welcome, Susan and Cori. I want you guys to tell us a little bit about yourselves. How did you get into audiology and start working with Expert Hearing?
All right. Well, I said to Amy, age before beauty. So I get to talk first. Honestly, that's a long time for me to think back, believe it or not. It's been probably 50 years since I went to college and grad school for audiology. And honestly, I wanted to go to med school, but said, oh, that's just too long a road and I want to have kids and didn't want to do it. To find out later that to get a doctorate degree, we ended up going to school just about as long and doing an externship. But I'm so glad I did it because it has been very rewarding. My father passed away when I was very young and from a brain issue that they didn't know what it was. And so I really was focusing on the brain and the hearing and how everything gets together there. And as time has gone on, we've seen how much impact that has had. So, yeah, that's how I got there. And then Corey and I, she can tell you how we got expert hearing.
I went to school at University of Georgia. I thought that I wanted to be speech pathologist. And as my courses continued on, I fell in love with the hearing side, not so much the speech side. So that led me through that path. And I ended up going to school in Louisville, and I've been doing audiology now for 20 years. So Susan and I have worked together for about 20 years now. We started Expert Hearing 2 years ago. We both have a passion of helping our patients, wanting it to be a very personalized experience, working with them. In starting this practice, we've been able to implement, and I'm sure we'll talk about it some throughout the podcast, some very specific tests. It does take longer to do, but it's very well worth it. And so we've been able to take that time needed with each patient and implement all those tests.
It's really cool that you guys have had the opportunity to spend so much time working together and then use all of that as you launch your business together.
Yes, it's been
Absolutely.
amazing. It's been an amazing journey. We can almost complete each other's sentences like we're married because we know each other very well and we look at practicing the same way. I
Yeah.
remember weird stuff sometimes. They go, how do you remember that? It's like because we take the time to listen to what they're telling us that might not be hearing related, but it's important to their life and we develop that
Um,
relationship.
I'll give one example. I had yesterday a patient who I've seen for the last 18 years. She commented asking about my children and the fact that in that time that I've gotten to know her over the years, I've gotten married and had two children, and she's now on her third grandchild. And so just to watch, our personal lives grow in that journey as we've worked together. And I know Susan's probably got hundreds of those stories as well, but just all those changes throughout your lives. And that's one part of our practice that I love is being able to get to know their families as well.
Yeah,
And having that time to be able to spend with them. That's huge.
correct.
My next question for you guys is what are some of the common early signs of hearing loss in older adults?
The first thing you hear is turn the TV down because people say, I can't even walk in the room because the walls are rattling because he's got the TV up so loud. Or you start to notice, and I've noticed it in myself sometimes, that I'll say, what? 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 And I count how many times I've said what in a room full of people, or you go to a restaurant and the waitress is giving you the specials and you're like, I'm not quite sure. Did they say this or that? And those are the things your family and your friends are going to be the first ones to say something to you like, you need to get your hearing checked because you're not hearing what I'm saying, or you mistook one word for another. But always the TV is the biggest indicator in the beginning, for sure.
That makes perfect sense. It's really cool that you guys have the ability to not only test hearing inside your business, but also go to patients' homes and help. Because I know in the home that makes a huge difference.
It does, because when we first started Expert Hearing, we were going in homes. We could see the acoustics in that environment and how they set it up with the significant other in there or their family, their kids. And we could really judge from one room to another what their problems were. And I wish we could go into more homes to be able to do that, because the value of that in the beginning was huge. We had one patient that she goes, I can't hear. And we heard a fan going and it was hitting the cord. And she goes, what's that clicking noise? It's driving me crazy. And then we could tell what it was and then deal with that in that situation. So being in the home is
Oh,
huge.
that makes perfect sense.
Yeah.
How does untreated hearing loss affect overall health, and what are the risks beyond just not hearing well?
One of the biggest risk factors we see is it can have an effect on earlier cognitive decline. That's one of the biggest things. And there's been repeated research, and even mild hearing loss can have that effect on individuals. It's very important to act sooner rather than later. Our goal is to keep them in their environments, doing the activities that they were doing, rather than, withdrawing from those environments. Keeping all the individuals active, engaged in their life, staying on top of what they love to do is a key factor in helping to slow or reduce that risk of cognitive decline. A lot of times we'll see patients that say, I used to be in the Kiwanis Club, but now I don't go to meetings because I can't hear what they're saying. And I used to go out to eat with my friends on Thursday nights, and it's just too much of a struggle. And so we want to make sure that patients can maintain those active lifestyles and doing those things and engaging with their family and doing the things that they love to do.
When I read the studies and when I see the patients and realize the number one risk factor for dementia that's modifiable is hearing loss. And it's interesting because I took a course over the weekend and it said, well, is it going to cause dementia because you've got hearing loss? Or is it just correlated? And the truth is, it's just a correlation. And the studies that show everything are, if you have dementia, you're more likely to have hearing loss. And if you have hearing loss, you're more likely to get the dementia. I have a passion for this because we're all living longer and medicine is trying to keep us living longer. But what medicine doesn't really look at, and Cori and I are trying to go to physicians in town, and I know you at Coastal Care understand you can live longer, but if it's not quality of life, it's not a good living longer, kind of aging in place. And if you can do something to modify that, whether it's diet or socialization or exercise or treating your hearing, you're going to live a better quality, longer life. And that's what we all want to do. I mean, I always tell my kids, I've got an expiration date if I'm not having a good time. So they go, don't say that, Mom, but it's really true. And modern medicine does a great job, but we've got to look at the things that'll modify having that risk of dementia. And the staggering statistics are that by 2030, 78 million people are going to be diagnosed with dementia. And by 2050, it's tripled. And that's an economic impact on healthcare in general. And if we don't start looking at hearing loss now, which is modifiable factor, as an economic impact later on, Medicare needs to look at this, and all the physicians need to look at this to try to modify that now so the economic impact won't be over the top in 30 years. I mean, 2030 is not that far away, even though it sounds it like on my credit card when it says it expires in 2030. I went, oh my God, that's forever. And then I turn around and go, no, it's not. It's in 5 years. So if it's going from 30 million to 78 million in 5 years, you can imagine the impact it's going to have. And I'm sure at Coastal Care, y'all see it all the time.
Absolutely. In our nurse care management program, we talk to clients about the difference in just getting through the day versus thriving. And that's sort of what you were talking about with quality of life. And so this
Right.
just fits right in. If you're having hearing loss and if that's affecting your cognitive abilities, that's going to affect your quality of life and your ability to thrive.
Audiology is sort of like a puzzle, and we have different tests to put the puzzle together, and no two people are the same puzzle
Mm.
pieces. And even if they look like they have the same hearing loss, it's not the same, their perceptions, their speed of processing. So one of the tests that we do that everybody gets a little scared about because they hear cognitive testing and everybody's like, oh, I'm scared to do that, which includes me. I got out of that test and I was like, oh my gosh, I need to go call a neurologist. But the truth is, we do those tests so we can better enable you with technology that's going to support you. So we know, we're not looking at, do you remember 5 things that I just told you? Because I probably won't. I can't remember when I walk into a room in my house, I go, okay, what did I walk in here for? And
I
then
feel
it's scary. And then it's about the processing speeds. Like, everybody slows down whether you have hearing loss or not. And the hearing loss just exacerbates that whole issue. And you're trying to catch up. So if we can see the patient has a much harder time than another one with that, then we can support them better and explain to them why they need this technology over another one, or counsel them in managing the situation that they have, which gives them better quality of life and keeps them engaged with their friends and family so they don't get isolated, because they do tend to back out because they're embarrassed that they didn't get it, and they shake their head that they knew, and they don't, and they slowly will back out. The National Council on Aging will show you that. There's studies on isolation.
That makes perfect sense.
It's important.
Why don't you guys walk us through what a hearing evaluation looks like at Expert Hearing?
First thing, we want to get a case history and find out what the patient, what's their hearing history in terms of noise and ear issues and all the basics there. But then we also want to learn more about their medical health. Like we've touched on, there's a lot of medical conditions that correlate or have connections to hearing loss. So diabetes, high blood pressure, all of those type things we want to get a history on. Of course, from that, we want to check the ear. So we have a really cool video otoscopy. So we get to take a peek, but the patient gets to see too. And people think that that's interesting. We want to kind of start from the outside in. We do tympanometry to see how their eardrum is moving. Do they have any middle ear issues, fluid behind their ear, a hole in their eardrum, anything like that? And then we would move to do the hearing test. And that, obviously, we've touched on this, it encompasses much more than just hearing the beeps. We need to know the beeps, we need to know the volume, but we spend a lot more time doing how the patient understands words. So we'll have them repeat a series of words back, both at a very soft level and a louder level. And then we do multiple tests on how the patient hears a noise. And I always say this is our real world test, right? Because that gives us a better picture of how do they do when there's competing sounds? How do you do when you're in that restaurant or in that family gathering or in that meeting? And so those tests will play sentences with background noise that gets progressively louder, and we evaluate how much difference or separation do they need to hear the signal, which in that case is a sentence, or there's another one that uses a siren noise versus hearing through that background noise. And so that's a big piece of the puzzle for us. And then the test that Susan was just describing, that CogniView test, gives us a picture of processing speeds, reaction time. Another big thing that tells us is their executive function, which is kind of inside of focus in on what you're listening to and ignore that background noise. And that kind of gives us a big picture of everything.
I don't think most people realize how much goes into it.
That's one of the reasons we started Expert Hearing because,
Mhm.
in big practices, you don't have time to do all these tests. And actually, 30% of the country are doing these tests. So we're like one of the only ones in this area doing it. But I think over time, you're going to see more and more people doing it because of all these documented links between the earlier cognitive issues. And there's more and more, studies are being done to back up the original studies. And hopefully
And
more physicians will get on board.
I'll give one quick example. I had a patient, that long-term patient of mine, that came in and she said, gosh, Cori, I'm just not hearing well. I'm really struggling in background noise. Something has changed. So of course we did an updated hearing test and we checked her hearing aids. Everything was working well with that. And then we repeated that CogniView test. And there had been a drastic change in that CogniView score. And that led us down a different path of what's going on and why isn't she hearing, as opposed to just, oh, it must be the hearing aids, let's turn it up. There's a much bigger piece to that puzzle. And I think that's why it's so important to look at everything.
absolutely. That's
100%.
huge. What are some of the latest technologies in hearing aids that families might not know about?
Been around for a minute, but it certainly has opened up a lot of opportunities for patients, is the Bluetooth, tying it to their cell phone. It has gotten a lot more sophisticated where they can control it, make changes, connect to various things, their television and their computer. That has opened up a lot of opportunities. And then I think the hearing aid technology itself has improved so much that it's using a lot more sophisticated tools to manage environments and to take samples, if you will, of the environment around you and be able to control those noise versus quiet versus distant speech, that kind of thing.
It's important for people to realize too, they think it's like a cookie cutter thing, but everybody's different and there are different levels of technology. Not everybody needs super technology over the top kind of thing that's expensive or more expensive than a lower end device, which could be totally appropriate for somebody with a milder hearing loss that does well in speech and noise testing. So we have to take all those test results and then figure out, and your budget as well, what's going to help manage this the best. And then you sort of weigh out the plus and minuses of what you can expect from that device. So the technology varies so much because we get people all the time saying we're going to Costco because they have cheaper devices. And we're like, we've got the same price points, but you get us. But it depends on the hearing loss. Really, really does.
That makes perfect sense. At Coastal Care Partners, sometimes we'll have adult children that will talk to us about how mom and dad are going to be resistant to care at first and resistant to the idea that they need help. What would you guys tell families if they have a loved one that's resistant to the idea of hearing aids?
Well, I will say that I heard the best answer ever at one of our we co-sponsored that dementia event at Palmetto a couple of months ago. And the most significant thing that would impact me if my children said it to me is that we love you and we want you to be part of our conversations, and you're not part of our conversation anymore. You miss out on hearing your advice and your wisdom or how you feel about something, and we missed you. And I think the patient that had said something, or the audience member that said that we want you here. We don't want anything to happen to you. We want you to be in our lives. And that would be more effective for somebody like me than somebody saying, oh, it's going to get you earlier cognitive decline, because you it impresses upon you the feelings of why you want them to have it, and that's important.
Yeah, that's huge.
And I think that's probably the biggest factor. I had somebody this morning at Kiwanis Club say, how am I going to get my husband to come to you? He just won't do it. He's scared of the cognitive test. And I said, I understand. And he doesn't have to do that test if he doesn't want to. But considering he's got family history, we need to really jump on this. And you tell him how much you love him and how much you want him in your life for a very long time. So I think she's going to go back and try to impress upon him that that's important.
And I think one other thing, and it might have actually come up at that same session that we had, is the patient always seems to be the last to know that they have hearing loss. The point to that is, in most cases, hearing loss is a very slow progression. And so people don't realize the extent of their hearing loss. They might say, yeah, I have trouble in a cocktail party, but they don't realize how many times their loved ones are having to repeat or speak up because they're doing that to compensate for them. I think that that's an important kind of part. We love you and we notice you're not, responding, or that you're missing what your grandchildren, or you're missing what I'm saying, and having that. And then just from a practical matter, Susan and I spent a lot of time talking about how everyone should have a baseline hearing test. And so that's another kind of way to get them in, to start that conversation. Whether they're ready for treatment or not, at least it's getting them in to kind of learn the extent of their issues. And a lot of times, once they see on paper and the results and kind of walk through it, then it's eye-opening, if you will.
Sure, that makes perfect sense. I already know the answer to this, but some of our listeners may not know. How do you guys collaborate with other healthcare providers, primary care physicians in the area, and nurse care managers? How do you guys collaborate?
We talk to caring people like Coastal Care Partners
I know.
that we know have the ear of the community. And we're involved in the Coalition on Aging, which has a wealth of people around the community that take care of senior citizens and people that are at risk of needing help and just getting the word out there. So it's more of a team approach to be able to hit these people somehow. And if they hear the same information from different areas, then they start to understand it's an entire team approach.
At what age should people start regular hearing screenings?
That's a great question. Typically, they say people get hearing loss after age 65. I would say now, because for many, many years, we have all been guilty of listening to things too loudly or doing power tools, do it yourself, home projects, and not thinking that we're susceptible to noise hurting our hearing. Even AirPods and, exercise with music blasting in your ears, and you don't realize that the heart's pumping and the blood supply is going to the heart, not the ears, so it makes the ear more susceptible to hearing loss. So I would say younger. I would say 50 or 55, or if you have family history of hearing loss, that you might as well get that baseline early. I had a patient when I worked at an ENT practice that who came in for ringing in their ears and sudden hearing loss because the airbag deployed during an accident. And they had no baseline. So it was a legal issue and they had nothing to compare it to because they had no baseline. And they probably did lose their hearing from the airbag deploying. So it's interesting. You really need it more than you think. And think about it. You go to the dentist every year, you get baseline vision tests every year. Why wouldn't you get a baseline hearing test every
Makes
year?
perfect sense.
So, yeah.
Can you share some tips for protecting and preserving hearing?
Go for it, Cori.
Stay away from loud noise. No,
Yeah.
one question kind of related to that I get a lot, I'm sure Susan as well, is people often ask about earbuds and what's too loud. And so the story of noise exposure is there's a ratio of how loud it is and how long you listen to it. And so loud sounds, for example, if you're a hunter, gunshots are instantaneous. It doesn't matter how long you listen, one is enough to cause hearing loss. And so things like the lawnmower, the weed eater, loud sounds like that, or a concert, anytime you're around things like that are prolonged, it has more of an impact on your hearing. So anytime you leave a loud concert or do anything and your ears are ringing after, that's the equivalent of your ear saying, ouch, that was too loud, right? And so wearing earplugs, hearing protection is key, and not just wearing them, but make sure you wear them properly. So you're wearing those little foam things and you're not getting them in your ear deep. then they're not doing you any good. So that's the biggest thing, is hearing protection, avoid loud sounds when you can, and not being around it for prolonged periods of
That
time.
makes perfect sense.
Right. One thing Cori said, I just wanted to add to was I had a patient say this yesterday. He said, well, I didn't realize I was around this fan all day long for 8 hours and I didn't think that was loud. And so that's the difference between the gunshot and the fan. You didn't think the fan was loud, but because he was around it 8 hours a day, 40 hours a week, he ended up getting noise induced hearing loss. And the noise is the only thing we can control with our hearing loss. We can't control the genes and our aging, but the noise you can, and nobody even thinks they're susceptible.
The thing I'll add to it is, in doing those case histories with patients, and I
Yeah,
ask, have you been around loud noise? And they'll say, no, I hadn't done that in 20 years.
right,
Well, 20 years ago still has an effect on us, right? And
right.
so people think, well, I haven't been in noise in years, but it does. And of course, when we're younger, we don't tend to think of, oh, this is going to cause me hearing loss in 20 years.
That's so true.
It catches up. Like everything else, it catches
Yeah.
up with you.
It does.
It does.
What questions should families ask when choosing an audiologist?
Wow.
Well, I think experience and education. There's a lot to hearing aids, and I think we've kind of touched on this throughout this episode, but there's a lot more to hearing aids than just turning on the volume and programming them, but making them personalized to what each person needs. And I think that's where experience comes in. And of course, education and knowledge, looking at the whole patient, not just their hearing and their ears, but everything and all those factors. Susan and I, being doctors of audiology, and not only all of our experience, but having 8+ years of education in the field is a lot more helpful to the patient. Having that relationship with the audiologist to be able to communicate with them and make those changes and make the devices work specific to them, I think is important, is being able to come in and talk and have that relationship is a huge component of
And
it.
you're just
It is. And one thing too that I've noticed is it's just like people say, if I have to have this big operation, you go to the person that does it the most because you want the best outcome.
Mm,
You're going to go to somebody that's done it over and over and over again. And the value of that experience of what we've seen, not just because everybody's got hearing loss, but listening to their journey or their problems or looking at their other health issues makes us a better clinician to be able to know it's not just turning on the computer and telling the computer to program for that hearing loss. That's not the answer. The success comes from us listening to them and guiding them and listening to their family dynamic as well. And honestly, the older I've gotten personally, the more the people can relate to me and I can relate to them to be able to solve that issue. So that experience and not just a computer
mhm.
fixing everything is
I think that
huge.
makes perfect sense. And patients aren't going to get that going out to just somewhere like Costco. You're not going to get that personal
No.
relationship, that time together. What myths about hearing loss do you wish that you could bust once and for all?
I bet we're going to say the same thing at
The
once.
hearing loss is a health problem. It's
Mhm.
not just a nuisance because you can't hear somebody. I mean, if
Yeah.
you look at all the links to all the medical issues besides dementia, I mean, there's a higher risk of falls. And I know Dr. Ayers, who's very involved in coastal care, knows that in the emergency room, the falls are one of the biggest complaints that people come in. And that is the highest risk of hearing loss with risk of falls when you don't have your spatial orientation and they fall. And then you can get head trauma, which obviously can go from a mild issue to death. Diabetes, kidney disease, depression, all of these things relate, hypertension. That's when the medical community needs to pay more attention when they have people for physicals and really look at the big picture because hearing loss is a healthcare issue for sure.
Where can our listeners find out more about expert hearing?
Our website, which is experthearingsavannah.com. Of course, you can call our office, come by our office. Coastal Care is right next door, so we're close by in the village, and we've got a couple locations now. And then follow us on Facebook and
We have a
Instagram.
YouTube channel. We
And the
also have a
YouTube.
YouTube channel.
That's awesome.
So,
I'm going to subscribe today.
yes.
Yeah.
Is there any one message that you would like people to take away from this episode about hearing health?
What Susan's already said about hearing is a health related problem, and everybody should get that baseline and have that information and know and get it checked.
That's perfect.
100%. Thank you for having us. We appreciate
Yeah.
it. My mission, which I know is Cori's as well, is for the medical community to understand all that we do so that they can better enable their patients to live a happier quality life. That's what it's about.
Thank you both so much for being on Aging with Amy today. And I can see some future episodes, a more deep dive into some other things related to hearing health as well.
That would be awesome. Thank you for having
Yeah,
us.
thanks for having
Thank
us.
you so much. Bye.